Good? Okay, perfect.
Before we have the press conference, I want to direct your attention over here to the screen. Last year, we had a journalist that visited our reservation, and he did an article on the situation that we have with the Indian Health Service, and he conducted a variety of interviews. So just for your information, we're going to show this to you.
No federal hospital has ever lost its CMS certification, and Winnebago continues to be the only one.
We are 15 months without the CMS certification. The application to CMS hasn't even been submitted yet.
Unfortunately, people can die while we're waiting for that to happen, and that's where we're at right now.
Losing a loved one there and knowing that many of our other tribal members have lost their lives or been misdiagnosed, it hurts to know that our people still have to go there.
Oh my God, his blood sugar is only 12. You could have died, you could have went into a coma. What the hell are they thinking? So my blood sugar went from 800 to 12.
Because her blood sugar was out of control. Nobody checked her sugar. They sedated her, sent her home. The next morning, unresponsive, took her back. Her blood sugar was 1800. People go into comas at 400 and 500, and she died.
We hope that we can structure this top-of-the-line healthcare system that would be comparable to something in the private sector, not this third-world healthcare that we're used to.
There's so much fraud and abuse and corruption going on right now within the IHS that's where a lot of that money's going. If they knew how to use this money appropriately, there could be they could fix this problem themselves.
When people do not do well at the field, instead of taking that immediate action and removing them or disciplining them, they oftentimes will remove them, and oftentimes they will promote them. You lost the focus of the patient. The funding would resolve many problems. But would it solve the quality problems? Would it solve the leadership problems? Would it resolve the bad habits that they've made over years, like promoting problems? No.
IHS is like an iron curtain. We can't get beyond that curtain. They're non-responsive, lie to us. They don't communicate with us in a timely manner. What information we do get is vague. We got to always ask for more information. It's still like they're hiding things.
Things that you would hope that IHS would have figured out or would know how to do, that information would be there, or that there would be answers to some of the questions that the tribe has had, but there isn't.
To them, a minor issue. To us, is extreme.
Do we wait for IHS to fix this? Or, at some point, the tribe is just going to have to draw the line and say, we can't wait any longer. We're just going to have to take this over.
Once we compact, then we certainly will get qualified professionals in here that provide the care. But between now and then, we still have to deal with the problems as they are.
That we're American citizens. We're not only, Native Americans living on a reservation. We're citizens of this country. And until those systematic changes take place, the Winnebago Hospital and many others throughout the IHS system will continue to be places where you can only legally kill an Indian.
Okay, we're going to start our press conference, and if there are any questions, can you hold them until we finish providing some information? My name is Frank White. I am the chairman of the Winnebago Tribe of Nebraska. I welcome all of you here today and thank you for your time and attendance in this important matter. On November 9, 2017, the Winnebago Tribe of Nebraska Tribal Council voted to initiate the self-governance process under the Federal Indian Self-Determination and Education Assistance Act. This means that the Winnebago Tribe is taking steps necessary to assume operation of the Federal Indian Health Service Hospital in Winnebago with the target date of July 1st, 2018. The primary goal of the tribe in undertaking this initiative is to improve the quality of care provided at the hospital. The Winnebago Hospital is a 13-bed facility currently operated by the Indian Health Service, including inpatient hospital, clinic, emergency department, pharmacy, radiology, and various other support services. It has a service population of approximately 10,000 Native Americans in the service area, including Winnebago, Omaha, Santee Sioux, Ponca tribal members, as well as members of other Indian tribes. On July 23, 2015, the Centers for Medicare and Medicaid Services, known as CMS, terminated the hospital's provider agreement because it said that the hospital no longer meets the requirements for participation in the Medicare program because of deficiencies that represent an immediate jeopardy to the patient health and safety. It is now November 14th, 2017. Over 2 years later, and the IHS has yet even submit an application for CMS for recertification. The Winnebago Tribe can no longer rely on the Indian Health Service to be in charge of providing health care services to our members. Over the course of the next several months, the tribe will engage in negotiations with the Indian Health Service regarding the terms and conditions of a compact and funding agreement, and will also take steps internally to prepare for the operation. The Winnebago Tribe will also continue discussions with the Omaha Tribe, which also has an interest in the hospital operations, to come up with an arrangement that will be beneficial to both tribes. Another very important part of this transition is retention of existing staff at the hospital. The tribe is committed to offering employment to qualified and eligible employees through a federal IPA, MOA, and direct hire by the tribe. Current IHS employees with questions about this should contact the IHS Area Human Resource Office. The tribe is also aware that there are a large number of positions vacant at the facility, and will be taking steps to prioritize vacancies that need to be filled, and will establish a process for doing so in the coming months. The tribe has engaged the services of consultants and special legal counsel who specialize in the tribal self-governance process and the operation of the tribal health care system to assist with this process. The tribe is also exploring partnerships and relationships that will be beneficial to the success of this initiative. There is a lot of work to be done, and the tribe views this as an opportunity to create a functional healthcare system that provides high-quality service and meets the true needs of our community. The tribe already operates multiple health programs, including dental, optometry programs under an IHS contract. Assuming the hospital operations and combining all the healthcare programs under one system without all the existing IHS regulatory restrictions will allow for efficient use of resources, quality healthcare, and patient-focused service. Like all citizens, access to quality healthcare is of paramount concern for the tribe, and that is the focus of this action. At this time, I would like to introduce Tribal Council Member Victoria Ketchian, who will be providing additional remarks, and then we'll be happy to answer any questions that you may have. Victoria.
Chairman. Good afternoon. My name is Victoria Kitchion, and I'm been working with my council over the past course of 2 years, advocating and engaged in the improved healthcare services at the Winnebago Hospital. We're devastated to learn in 2015 that we lost our CMS certification and the standards for participation. We've been advocating for quick and concrete changes within the agency for our service unit, and as well as other service units throughout the country that have been identified as troubled. And it's this work that we've done on the national level and that we've done to build the capacity of the tribe and engage in this policy work on the national level that has prepared us for the challenges we'll face in assuming control of the hospital. After 2 years, we had no other choice but take a proactive role in improving the healthcare at the hospital. We know this initiative is going to involve many challenges, but as I've stated, the council's committed, as well as our directors and managers, to taking this effort on as a tribe, and for the confidence that we've put into our team is for the livelihood of our people in the future. These healthcare challenges did not happen overnight, and we know that they're not going to be remedied overnight, but we're equipped and capable to take on this for improvements. We're excited, we're hopeful. There are about 368 self-governance tribes, and every tribe that has engaged in self-governance have been able to offer improved quality care, and we expect no different outcome at the service unit here. We're excited to redesign the programs, functions, and services and use those dollars to maximize the healthcare outcomes for our people. And it's through this tribal initiative that we can cut through that federal bureaucracy that sometimes impedes the progress and the outcomes we hope for at IHS. So I know that there are probably a lot of questions, and we are engaged and ready to answer those questions and work through the challenges that we may come through as we take on this endeavor. And I just want to instill into all you kind people that came to this press conference that when the Winnebago tribe takes on an effort and initiative, we do it with great planning and great careful care, and we do it with the goal to succeed. And like other things such as gaming and economic development, we're ready to take on the healthcare initiative with that same tenacity to succeed. With that, I'd like to open it up if there are any questions. Yes. So the tribe passed. Will you please repeat your question? This gentleman asked what happens next and what will the tribe do in preparation for July 1st. Well, the tribe's already been engaging in a year-long planning process. We've done ample outreach to the agency to collect the information we need to do the proper financial analysis, to do the human resource analysis, the technical work with the facilities, the property, all these things we did. We formed committees, and from those committees there are subcommittees that really dive into the technical aspects of this work. And so we have folks on our tribal side that are reaching out to their counterpart through the direction of our area office, and through that gathering and analysis, it's the transition will take place on the workload and the infrastructure that we need to build to manage this. The tribe has done a lot of this work internally in preparation for this opportunity, and that includes some of the elements of participation. We received a clean audit. We received the nod from the Office of Self-Governance to continue on in this process. And so we've done things in our tribal organization to build up our capacity to be ready to take on such an endeavor. And we take it very seriously, and we want to let you kind folks know that we are equipped with the special team, legal counsel, special consultants, and we really put together a dynamic group of folks that will see us through this effort in partnership with our tribal council. Is there another question? Yes, sir.
My question is,
Thank Thank you, Chairman, for your remark, and we as well share your concern on the welfare of all tribal people and the health care that this facility will provide. As you know, we've been engaged in conversation with the Omaha tribe over the past 2.5 years since we lost certification on July 23rd. And so we look forward to continuing those conversations. And the Winnebago tribe has just started the process and made the statement that we're entering negotiations. So no negotiations have taken place without account of the Omaha Nation. And I just want to assure you, Chairman, that we look forward to working cooperatively with the Omaha Nation. And I think your council shares the same concerns as we do, and as we work towards these challenges and work through what it's going to look like. But at this point, Winnebago is positioned to move forward, and we hope that we can continue the discussions nation to nation. Chairman, did you have a remark?
Chairman Wolf, I'm saying thank you to you for your comment. And I need to remind you too that on about 4 or 5 different occasions you and I met talking about this issue. And I felt that, you know, as a leader of the Omahas and the leaders of the Winnebago, that we needed to discuss this matter. And I've asked for meetings, and I've asked for cooperation. And if you look at the immediate need on both reservations, is that we still have health care problems. Our tribal members are not receiving the adequate health care. And I look forward to the meetings in the future. We have yet to come to the table with IHS concerning any negotiation items. And when we get to that point, I'm sure that the Omaha Tribal Council is going to be part of that discussion. So I appreciate your comment. Are there any more questions? Sir. Question?
Yep. Thank you for that question. The main goal, our immediate goal, is to stabilize the operation. As you know, there's been a variety of leadership that has been circling in and out of there on acting capacities for the over 7 years. We haven't had a consistent leadership in that facility, and that has led to some of the dysfunction that permeates through the building, the services that come out of that building, and the relationships that that grew out of that dysfunction. And it's so great that the life and the services and the people became in harm's way, and it wasn't the quality or the patient that was in the foremost. It was this dysfunctional organization that had forgot about patient care. And so when we talk about stabilizing that organization, it needs to be stabilized from the top down with the leadership. And as our tribal members are concerned on what it's going to look like, it's going to look like a state-of-the-art facility where we merge best practices and tribal health facilities best practices. As I mentioned, there are 368 tribes that do this work and have amazing programs from Alaska to Oklahoma, and we will be learning from these processes and engaging with the self-governance tribes to really put a program together that best meets the needs of the local community. And IHS area office cannot make our decisions for us. IHS headquarters office in Rockville will no longer make our decisions. The body and the board that oversees this operation will be making decisions on behalf of the people and the patients that it serves. And it's this new model of governance that's going to break down this bureaucratic barriers that exist with hiring, with salaries, with retention, recruitment. All these things that right now are being done poorly at the agency level can be amended through a tribal facility where we're in complete control of the programs, functions, and services. And so it's our desire to maintain the operation and get it up to speed. And in the future, we'll be designing programs and expanding services as we'll have the revenue to do such things. And right now, that's not happening. So we had to take control of this situation, and the mechanism through the self-governance process is the way to do that. And with full confidence, we're ready to take that on, and I'm just really hopeful that the next press conference we hold will be when we assume control of that facility. Yes, sir. There's going to be a board that's going to be made up of subject matter experts, community members, and council persons. And so it's through this structure that has yet to be finalized that there will be a voice. And I encourage you to continue to show your interest in involving yourself in the communities, the health boards, and those things that our tribal leaders need to hear so that programs, functions, and services are designed around the true need of the community. Are there any more questions? Yes, sir. So as I mentioned before, we had received a planning grant in which we used, and now the next step in this process is to enter negotiations. And that's where you get down into, they call them shares, and the respective shares are tied to, have financial ties to them. And we look at and decide which programs, functions, and services that the tribe will assume. And it's through that analysis that we can decide through our committees which ones that we think we can manage best. And so right now that process is still underway, and then we'll enter negotiations with our special legal counsels to what that would look like for the tribe. Yes. Thank you for that comment, ma'am. The tribe has been engaged for the past 2.5 years in this process, and last fall we did hold community meetings, but it sounds like we need to hold some more community meetings and get that increased outreach out there. But we have engaged in community meetings, we have engaged in this discussion over some time, and so I'm sorry that you did not get an opportunity to attend those meetings, but we did not jump into this position. We do not take this very lightly. The tribe, the membership, our healthcare, there's an extreme amount of burden with this initiative, and we do not take it lightly. We would not rush through the planning process, and we've had this parallel effort for 2.5 years. So I think I'll take this comment back to my council. We'll hold increased meetings, but this was the point that the tribal council came to as we had a parallel effort to pursue self-governance as the corrective action plan was not making progress. So to this point, the corrective action plan is still not corrected. The application for CMS certification is still not happening, and we just have zero confidence in IHS to correct that process. Healthcare will continue to be offered for all eligible recipients, and it doesn't matter if you live off the reservation, you continue to receive your health care. And I just want to assure you that this effort has been well thought out, well planned, and we have an amazing team of special legal counsel consultants, and of course our counsel and in-house general counsel has put their best foot forward in this initiative. And I just want to hopefully put some of your concerns at ease that we're in front of this. And as we continue to hold these meetings, I hope that your comfort level will increase, and I hope that you can support this project because it's going to be good for everybody. And like I said, 368 tribes do this, and they do it well. And it's just another project that we're going to take on and do just as well. Are there any more questions? Yes, ma'am. Yes. Oh, may I respond to this one? Okay. Yes. In no way does the self-governance process erode trust responsibility. In no way is the Winnebago tribe eroding trust responsibility or the responsibility of the federal government to provide the health care that was cited in that 1865 treaty. In no way would we allow that to happen. What we are allowing to happen is we're pursuing these shares, these dollars to redesign the healthcare system, creating that same level of care, but redesigned by the way that the tribal community best sees fit. So the federal government agency is not going to come in and say, tribe, this is the way you're going to do it, and this is how much money you have to do it with. And these are all the barriers that we're going to give you to prevent you from accomplishing that. So we get the same amount of resources, but we have the flexibility to design those dollars and programs and functions to the needs of our community. And so through that process, nowhere is the federal government let off the hook. And I just want to instill that into everybody in this room, because I think that's the biggest thing that I hear, is that we're eroding trust responsibility or that we're letting the federal government off the hook. In fact, that's not true at all. If anything, we're holding the federal government to a higher degree of standard on this is what healthcare should look like, and this is what we're going to do as a tribe. Next question, please. No, I don't, but I can follow up with you on that. The shares are tied to user population. They're tied. This service unit has a collective patient, I guess, a collective outreach of 10,000 patients. And so the analysis and the specific a dollar amount tied to a specific share, those are also in different departments, like the inpatient, the pharmacy, the ED. And so that's the analysis that's underway right now, is that analysis of the shares and how much money. And so you are correct that Navajo, a much bigger population, Cherokee, but that doesn't discount what we would get. We get the same money that's going to that service unit right now that's comparable to our shares. And so we're not going to have any less. We're just going to be able to use those dollars more efficiently and more wisely as appropriate to our community. Not this cookie cutter healthcare system laced with bureaucratic dysfunction that is not working right now. No, ma'am, that's not right. The agent, you are correct, the agency is underfunded. Matter of fact, funded at 45%, 45%. So that 65% of underfunding, we count on that third-party revenue to collect. And Winnebago Service Unit has not collected third-party revenue in 2.5 years, since July 23rd. And so it's that third-party revenue that makes up for the lack of funding from the agency. So we heavily rely on that third-party revenue, and under the IHS umbrella, CMS, the sister agency, shut down IHS, and they said, no more. You're not going to provide inadequate health care. You're not going to put people in jeopardy. And it's that loss of CMS certification that has brought us to this point today, because they have yet to receive that recertification. We have an estimated $11 million lost in third-party revenue, and that $11 million would have went directly to patient care. And so you are correct that we need to restore that certification. We need that extra, it's not even extra, it's what we're able to collect on the services provided. And so until we have that CMS certification restored and we do it as a tribe, we're gonna still lack that funding, and we will still be funded at 45%, which brings me to the point that why we had to take this effort on behalf of the people, why we had to take over the healthcare system, why we have to restore that CMS certification. We do not take this lightly, and we did not approach this lightly, and it's through that loss of revenue and life that we've come to this point.
Oh, Nikki, I'm gonna say thank you to you, and I want to let you know, and rest of the people in attendance, that we are going to be having some forums. We have the next one scheduled for December 4th. It's going to be held at the Black Hawk Community Center at starting at 5 o'clock in the evening. And there we're going to provide more information to the communities or those that are concerned about this particular issue. And I need to remind everyone that, you know, the number one issue, number one focus that we should have is the care of our relatives. That's what we're working towards. You know, the money is going to be there or the money is not going to be there, but we're going to provide proper care for all of our relatives. That's what we're working towards. Right now, Indian Health Service is not doing that. And it's true, we have a treaty, and that was passed in 1853. And in there, our treaty says that they would provide health care. Okay, I've traveled, and different places I've traveled to, and people that I've heard them say that those treaties aren't worth the paper it's written on. And you know, taking that in mind is that there's a total disregard for any kind of agreement that the U.S. government has with us sovereign nations. So we're taking upon ourselves. You know, who's better to care for our people than ourselves? We can't allow Indian Health Service to continue operating this way. So that's why we're doing this. Thank you, Nikki, for your comments. And then November 4th, you know, we'll give you the opportunity again. I want to also introduce a gentleman. He represents Congressman Fortenberry's office, Lee Klein. He came to listen and see what's going on, and I'm glad that Congressman Fortenberry's office is willing to listen to us. And some of you weren't here when we showed this video, but we had a video, and we're going to show it a little right when we're completed here. For any additional information, visit our website. We're going to be posting more information on it, and I'll have the crew here show this video so you understand what we're working towards and why we're working it so hard to try and get this self-governance completed. We haven't reached the negotiation stages yet, but we will, and hopefully in the near future, the Omaha tribe and the Winnebago tribe are going to be working together. Chairman Wolf mentioned it. Indian Health Service, if anybody is aware of it, the Indian Health Service has been dividing us for years and years. And they created this. And over the past several months, we've been working on getting together and working together for the same thing, and that's for the well-being of our relatives. So with that, we're going to conclude this press conference. I'm going to ask the crew to show this video so you know what's in there. And thank you again for coming and taking time out to listen to us and watch. There's going to be more things coming. You can go ahead.
No federal hospital has ever lost its CMS certification, and Winnebago continues to be the only one.
We are 15 months without the CMS certification. The application to CMS hasn't even been submitted yet.
Unfortunately, people can die while we're waiting for that to happen, and that's where we're at right now.
Losing a loved one there and knowing that many of our other tribal members have lost their lives or been misdiagnosed, it hurts